OSF has been part of this community for over 110 years, and we look forward to another 110 years. We employ upwards of 400 employees, and as we look at the relationships with the Economic Development Council and what we're trying to do to attract and retain business opportunities for our citizens.
We're very gratified by the recognition by Forbes as one of the top employers in the country, and certainly the top in the state of Illinois. And that's a wonderful recognition. OSF has enjoyed significant growth over the last 15 years.
Patients coming in the door and having access to more than just St. James Hospital, that is 100% accurate. Walking in the door really opens the door, I would say, to all the wider specialties OSF has. 22,000 mission partners and growing. We're developing more service lines. We're developing more multi-specialties.
But we also have access to the Life Flight, which is only 20 minutes away from Peoria, which brings that extra level of care that much closer for our community.
Our physicians are trauma trained, our nurses are trauma trained. They're able to give you any sort of care that you need at any moment.
OSF's mission started with the first sisters who came here 144 years ago, and it continues today. The sisters' mission has remained unchanged, and that is to treat all with the greatest love and care.
I think anyone that is going to invest substantial resources in the area should feel confident about our hospital. So I think about, from an employer, one of the best things I want for my patients is to stay healthy. What I really want is that touch point that they have ongoing care close by to keep them working. Those patients that we're taking care of are going to be given really great wellness-driven care. Having a close facility where you have a great primary care base probably would be the most important thing. But then having that connectivity from the primary care base to have that ongoing subspecialty care. The people that we serve are going to need more than just primary care. They're going to need other subspecialists.
We're part of OSF, and OSF is not sitting on their hands. We have access to all that innovation, all of those services. We have a presence in 7 different communities around the county, but also the access that we have to additional services. Our staff's done a wonderful job of caring for those patients. My chart gives patients full access to the chart. And when I say full access, not just with that physician visit, but the CT scan that was performed over at St. Francis last week, maybe the procedure that was done at St. Joseph's. It pulls everything together to give the patient and the doctor a good comprehensive look at that person's health care. We can talk a lot about innovation and about the future, but when you really want to see innovation at work, you start talking about telehealth. We've taken that to the next level with telehospitalist neurologist, so that way they can get that specialty care neurologist looking at that patient right from OSF St. Francis over in Peoria. We're also looking at tele-neonatologist. We're looking at telepsychiatry. Really, the potential is almost endless.
I chose OSF as a nurse originally because when they make a dollar, they don't put it back in their pocket. They really look at putting it back into the community and what we can do to better the healthcare that we're providing everyone in the community.
And so I would look at the recognition by Forbes and by others as certainly gratifying, but it's really confirmation that all of the hard work throughout the organization is really paying significant dividends.
Regardless of the location, if it says OSF on the door, we want to make sure that we're providing that consistent care throughout all of Illinois.